Thank you very much, Cassie. And again, yes, thank you very much to all of our speakers from our keynote this morning to the two panel discussions. I think it's been a very interesting exchange of various experiences, approaches, and actual interventions on digital mental health. We have a few questions from the chat, but maybe I'd like to start with a question that we prepared before this forum that I think this was also shared with our speakers. So this is an open question, anybody can answer. But I think one thing that was also clear to me when the different panelists were sharing their experiences is also to make sure that we find ways of encouraging the target populations that we want to help to actually take up the intervention in the first place. And that's a combination of various interventions in and of themselves, marketing them properly, maybe branding them well. I noticed, for example, the graphic work that went into the interventions from New Zealand. So any thoughts from our speakers on how we can encourage people to actually take and use these tools as part of their coping or daily life? Maybe I can ask the team from New Zealand to share their experience.
Yeah, sure. I think that's the number one, $1 million question. And we know that these things work if people will use them. And I guess we know that people will use them when they need them. I think we're having a conversation in New Zealand in the sort of recovery phase about digital tools to support wellbeing in this phase. And what we do know is that people will go and find a tool when they want it. And I think the other thing that we kind of bear in mind is that digital tools, like this is how we use all our apps, and it's not just mental health digital tools that people kind of go on, use them, get what they need, and then forget about them a little bit again. But they often don't take them off their phones either. So it's kind of like they're there as a backstop and they will go back to them. I guess we used... so the Facebook changed. We were using Facebook Messenger and then Facebook sort of rules changed. So we were using the concept of a daily reminder as a way to bring people back. So a reminder about in some of our chatbots about, have you done this thing that you thought you might do today, or have you put something into your gratitude journal or whatever it is. But that sort of use of reminders can be, and then gamification, I think, is the other thing in the digital world in terms of what's in the app to keep people coming back. But and you could see we had quite good reach into lots of professional sort of networks and into government in New Zealand. But I don't think that's not where young people go. So I mean, I'm happy to sort of hand over to Sarah, but that's why we brought Sarah into our team, is to really design and develop and put the social media campaign so it would go to where young people are.
Right. Sarah, anything you wanted to add? I think you were talking earlier about promoting the tool using Instagram, which we know is a very popular platform among young people.
Yeah, I think we are finding that young people in particular are one of the hardest audiences to reach, which I guess in many ways is, we could think of this as a positive thing because young people are actively aware of advertising and they know that, they see that this is an ad and they don't want to engage. And they are really, they have their communities online. So they're not open to, government organizations sharing their tools with them. But at the same time, it's really difficult for us to say, hey, like, we're trying to make this to help you and we want to make it with you. So it is about sort of setting up those good relationships and also, like working with community groups alongside the sort of advertising and the social media aspect of things.
Right. Ken, I think I saw you were raising your hand earlier. Was there something you wanted to add?
No, sure, Jason. Thank you. Yeah, I just wanted to mention, I think this is a great question, and I think it's something that probably all of us here think about. For me, there's been, I think, the involvement of users in all aspects of the research, taking like a user-centered or human-centered design approach is hugely important. And that's not only in terms of the sort of graphical design, but also as colleagues there were saying, just around what platforms are used, how do people perceive things like a government-based intervention as opposed to an intervention given by somebody else, issues around trust. Certainly our work at WHO in the last sort of five or 6 years since we've been doing the sort of internet intervention work has progressed from a more of a, I suppose, a sort of top-down model where we might write an initial intervention and then we might test it and adapt it with users, to now more recently with a couple of other projects, we've been trying to do something where you take a ground up and top-down approach at the same time and put them together. So what you do is you write little bits of the intervention based on evidence, based on what we know works. You take those small parts to the communities, you test them, you prototype them, you get a better understanding of how that's working, and then you iterate it from there. And my sense is, we're still in the early stages of this, but my sense is that doing it in this approach, which is an approach that, you know, a lot of the big social media companies and similar use, taking this approach, not only do you maybe sort of save time because you're not adapting a whole intervention to your users, but you're also actually maybe coming up with something that's much more engaging. And you're learning a lot about the community as you go. And certainly going through that process, I found it very surprising, some of the assumptions I had. So for example, some people that they wouldn't be able to access videos because data was so expensive. Yeah. And then when we went to the communities, we found out people could access videos and always were. And they found very creative ways of getting online and things like this. So I think for me, that'd be one way of addressing that, is to take that very user-centered approach.
Right, thanks, Ken. And certainly echoes a lot of the points that were made earlier about cultural adaptation and implementation science. Would any of our other speakers like to add any other points about getting actual target end users to use these interventions? Okay. Another question that's been raised, and I would actually direct this to Gina and maybe and to Marcus, is a question about security. As we know, because of the very sensitive nature sometimes of the conversations that we have to have with our clients regarding their mental health and some personal crisis in their lives, the issue of security and guaranteeing confidentiality is a very important one. So maybe Gina, can you share a little bit with us your own experience in doing this online platform, whether in the synchronous or asynchronous model, and how you're able to ensure or reassure your clients about the security issue? And maybe Marcus, because you're looking at this kind of global framework for governance, what are your own experiences as well in developing this framework to make sure that security is taken into consideration? So Gina, would you like to start?
Sure. So thank you for that question. When we began the project, when we do select facilitators, a big chunk of the training of the facilitators is ethics and telepsychology, especially telemedicine ethics. So, and we did have very explicit sort of guidelines about things like you need to use earphones, you need to be in a private space, you cannot record, you cannot take pictures without the consent. So making very explicit norms about what you can and what you cannot do, and then discussing it in the first session with a group. That's part of the norm setting. Will you even show your face? Will you even real names? So these things are discussed as part of the sort of norm setting within the groups, and I agree, that's really part of the training of our facilitators.
Wonderful, thank you. Marcus.
Yeah, thanks Gina, and thanks Jason. I think it's a great question, and it comes up a lot with consumers because they're really sharing quite personal things when they're talking to these systems. And it also comes up because of experience with hacks and with data being leaked out for whatever means, both deliberate or accidental. I think, the first aspect that's important to understand is that these challenges, security and privacy challenges, are surmountable. We have identification, we have authentication systems. These are systems that have been solved. You do million-dollar transactions on your phone with your bank accounts. And so these are are solvable and overcomable challenges. And when, sometimes when I'm talking to clinicians, the security or privacy is used as an excuse not to engage with digital services. So I just ask you guys to think that it's not an excuse, it's not a reason not to engage, rather it's just a speed bump to overcome on your way to implementing really good digital mental health services.
Great points. Thank you, Marcus and Gina. There was also a question in the chat box about, and I think this points towards equity and whether or not by introducing these digital interventions, we are inadvertently introducing more inequities, paradoxically, because of various reasons. Maybe people are not comfortable with technology, or the necessary infrastructure to access these interventions are just not available. So I'd like to pose this question to our researchers, to Adrian and Millet. You talked a lot about cultural adaptation, implementation science, and really working with the end user. From your experience, when people are presented with these digital interventions, is this something that they welcome? Are there populations that we are not reaching, paradoxically, because of using these digital tools?
Yeah, I can address first. Sorry.
Sure, please go ahead.
Yeah, so the Kumusta Kabayan built based on previous feasibility as well by our colleagues here. So why previously we have the website version, but based on the feasibility study, they prefer a mobile phone app because it's much easier for them to open it, because not all of them can access computer, for example, or they have to go to library, for example, to open the website. But using the mobile phone app, they said it will be much easier for them to access. And yes, they have a smartphone. They have also Wi-Fi or internet connection and can sustain the internet connection. But in our testing, there's kind of a reality that there's a lot of phones, brands of phone. For example, we have an Android, we have an iPhone, have a different technology. So that's why, like Stian mentioned, we have to communicate with the developer what situation that we find in the real life, so the developer can help as well. So answering the question, yes, the digital health is welcome by the migrant workers here because they can easily access the app through their phone. But maybe Milan have a different experience with students, please.
Okay, I would like to share my point on the obstacles of making telecommunication. I think one issue based on my experience is about participants' adherence, because this is unlike face-to-face communication like the traditional consultation. The participants may be not so serious and may think that this is a game because there is no monitoring system. So some of the solution I have used or I'm thinking of to use is to first understand people's needs. And if your offer is not what they need, of course, they will not take it so seriously. And the second is to make the programs interesting and interactive. And I already heard a lot of very exciting apps or programs that you presented before. And I think that's enough interesting and interactive. So the third point I'm thinking about is that for if we offer a platform of different set of packages, we need to set some incentive system and a rewarding point, and that will encourage people to adhere to the guideline. And the last point I think is also the most important is to make use of the social relationships, because social network is very important in both collective cultures and I believe also in individualist cultures. And the people, if they get together and they can communicate and they will encourage each other, that would be a very good incentive to encourage the adaptation of digital intervention. That's my point. Thank you.
Thank you very much, Professor Gan. Milette, over to you. Anything you'd like to add about, especially with your work with students and young people?
Yes, and thank you, Adrian and Professor Gan, and thank you for the question. Actually, I agree with Professor Gan about the point that how to attract Chinese. And I think in our Chinese adaptation, we start the adaptation for Chinese young adults is because they have higher digital literacy. So actually for them, it's very easy to use the program without any difficulties. But whether they have a smartphone or is another problem. But in Macau, like the college students, they basically they own a smartphone or iPad, and so that they can easily access the app. And to make the intervention attractive, it's important to include some elements related to their culture or their life experience. For example, we use some slang or terms that young people use a lot, so that when they use this program, they feel that, oh, this program is designed for us, and they can kind of be motivated to keep using it. Yeah.
Thank you, Milette. Professor Kuipers, I see that your hand is raised. So good to see that you're still with us, and at a more reasonable time, I'm sure.
Thank you. I was I had another meeting, but I stayed here also. But what I wanted to say about the digital device, I think that's a very important issue because a lot of people don't have access to the internet. And what I wanna say to this is that you can apply the same principles without technology. I mean, it sounds all nice that you offer these interventions through the internet and it's high tech and it's innovative, but you can also just print a book and call people every week to support them while they work through the book. There is no indication that if you apply the intervention through the internet, that's more effective than giving people a self-help book and calling them every week. So I think that's important to keep in mind. So if you develop internet interventions, you could just as well make self-help books of that, low-tech books, and just give it to people and call them once a week. That's what I wanted to add. Thank you.
A very important and wise point, Professor Kuipers, that tech doesn't necessarily have to be high-tech. It can be low-tech as well and still be effective. As a final question, maybe I'll direct this to Dr. Liu in Singapore. Very fascinating example. When we were talking about the program, we were quite really interested and keen to hear from you because this is really a phenomenon that I think for the first time we're having to grapple with at such a large scale, these infodemics as they've been described. What has been your experience? Because the way I understand it is that what you've provided is an alternative but credible source of information. But we cannot really foresee, for example, what kinds of misinformation or disinformation will happen. What has your experience been in using these tools in building the, maybe shall we say, the general health literacy of people so that they themselves can be good, they are empowered to assess whether information is credible or not?
Right. So the first thing we observed that's actually quite fascinating is that people often share rumors even when they don't believe them. So that's actually quite
Wow,
puzzling,
okay.
you know. And that tells us, so for example, we had 5 common rumors.
Mhm,
There was one in particular, the rumor that, you know, COVID-19 was started in a American lab,
mm,
that very few people believed. Everybody who shared it did not believe in it. So that tells you that, you know, our typical strategy that we use to just tell people facts may not be
mhm,
enough to spread the spread of rumors. But nonetheless, I think that their WhatsApp use. The reason why I was really fascinated by it is that this WhatsApp actually managed to break our typical barriers that we say about the take up, right? So a very large number of the population in very quick amount of time actually adopted the WhatsApp service. And what we found was that quickly dispelled rumors from
mhm,
of a certain kind. So the kind of rumors that were quickly dispelled were things like, oh, someone died from COVID-19 today. You have to understand, Singapore is a very small country. So if somebody dies, you know, everyone knows about it. It's a very big thing.
mm,
So, you know, those kind of rumors that could, is factual, very easily verified.
mhm,
Those kind of rumors were, you know, this kind of WhatsApp service quickly dispelled it. But the other kind of rumors that said, you know, eating garlic will be preventative. So the kind of health information
yeah.
related health literacy rumors you're talking about, and that WHO takes a lot of pains to counteract, actually don't, you know, people will still spread. 1 month later, you still see those rumors being spread around. And the fascinating thing is that we didn't just do this in the general population. So I
Mhm,
only presented my work on the general population. Some of you may know that Singapore's largest COVID-19 outbreaks actually came in our migrant workers.
right.
So Singapore has a very large population of manual labor migrant workers who were all locked down in dormitories. So about more than 90% of our cases have come from those dormitories, and the migrant workers continue to have um, restrictions in movements. So we were very concerned, and we ran a mental health survey of 1,000 people there as well.
Mhm,
We also asked this question on rumor spreading, and it turns out that, you know, the most commonly spread rumor amongst the dorms was not about bad soup, is that come from a China lab, American
mhm,
lab. It's not that kind of rumors. It's all about the category you just asked, health literacy. So it's all the, you know, what can prevent COVID-19 spread and so forth. So I don't have a solution about whether, you know, this actually helps with health literacy, but I can tell you
mhm.
that, you know, surprisingly often rumors spread without people believing in it.
Right. Thank you very much. Very interesting indeed, and also, frankly, very alarming that people are just so easy to click and share without really giving it a second thought. I think that ends this second open forum. So thank you very much again to all our speakers for answering the questions that have been raised and for the very interesting and insightful discussion.